It is no secret that the heavier you are, the higher the chances you will develop varicose veins. Now, it is a risk factor, we know this. And we also know that when you're heavy set, overweight, or obese, there are risks of other medical issues. This is no secret. Treating varicose veins when you're heavy set, overweight, or obese can also be a bit more challenging. So for some of my patients out there that are a little bit overweight, obese, these are some of the factors you may want to consider. Now, despite the fact that I know that you try very hard to lose weight with dietary changes and even exercise regimes, it is absolutely imperative that you continue a healthy diet, also known as an anti-inflammatory diet, because there's a lot of studies out there to suggest that by having a diet which reduces your inflammation, it helps in multiple areas of your life and your general health and well-being. It also reduces the inflammation within the varicose veins. So if you're interested, you can always look up an anti-inflammatory diet by Googling it, and there's a lot of information out there about the types of diets. Essentially, if I were to boil it down, it would be a relatively healthy diet, and most people kind of know what that is. Next would be the fact that despite being overweight, you can get great results when you get your varicose veins treated. Now, they can be challenging to be treated in the first place, but if you put that aside, you still can get really good results, but you do run the risk of recurrence because, again, the heavier you are, the higher risk of getting varicose veins. Now, if you're still finding it very challenging to lose weight, over the last 10 years, there has been a lot of evolution in terms of bariatric surgery and the options and also the results that they're getting right now. So this could also be an option, especially if you're finding it really hard to lose weight. And finally, I would mention medications. Now, I'm not a big fan of medications. I've never really been a fan of medications, but there have been a lot out there, including some used for diabetes that helps reduce weight. And I'm not against it, especially if you're working with a qualified doctor or health practitioner who can guide you along the way in order to help with your weight.